Hi everyone and welcome. Let's talk about completing our medication template. On the first page of your medication template, you have the background information for your medication with some key things that we would need to collaborate with a healthcare provider. On the second page, we have our care plan wheel, where we would write calcium channel blocker or CCB in the center and the abbreviations for some of the problems. Where do we get those problems from? We study the med on Daily Med and we look to see what are they pointing out as a concern. So let's get started. We need to find out the class of giltiazem. So when you scroll down here in class, you're going to see these plus signs. When you go to read, you can see right here that this is a calcium channel blocker or antagonist. So if you go to clinical pharmacology, it'll explain it a little bit more. But I want you to just consider, if you're a calcium channel blocker, the muscle is not going to have to work as hard. If it's not working as hard, you're not going to get the contraction. So in cardiac muscle and in smooth muscle, that will cause dilation, supplying more blood through coronary arteries, and it will cause relaxation and vasodilation, lowering the strength and contractility of the pump and reducing the resistance in the blood vessels, lowering blood pressure. So once we understand that, we start to realize why you can't use this medication in heart failure patients. And let's go down to what exactly we mean by that. Let's go down to contraindications. We see here that it's used for stable angina, not for heart attacks, but for angina. And that makes sense because it supplies more blood supply in the coronary arteries through its relaxation. It is not used in heart block, and it is not used in heart attacks or pulmonary congestion. So when you look at your sheet here, you have here that it's a CCB, and it lowers blood pressure and anginal symptoms, okay, by decreasing the workload of the heart and also by decreasing the rate, because it also actually slows down the heart rate. When is it indicated? When a client has stable angina. It can also be used for high blood pressure. When is it contraindicated? It is contraindicated in MI, heart failure, and Brady dysrhythmias and heart block. Okay, now why is that important? It's important to recognize those things because we see here in the red boxes that if we don't have the indications or we have the presence of a contraindication, we have to contact the HCP. So now we're beginning to learn, when do we seek clarification as we complete our medication reconciliation record? What if our client who is on this for angina develops a heart attack? Should this medication be continued? When we look at the focused assessment, what we're looking for is it working? And are contraindications, precautions, or warnings arising? And if those things are occurring, then we would look for those signs here. So a sign and symptom of a heart attack, shortness of breath, chest discomfort, nausea, vomiting, diaphoresis, activity intolerance would all be signs of a heart attack. Signs of heart failure, dyspnea on exertion progressing to dyspnea at rest with weight gain, shortness of breath, changes in mental status. Those are signs of contraindications. So if they're present, you have to look for them first, then we're going to be calling the HCP. So we want to know those things. So if we see evidence that our client is experiencing the MI, the bradycardia, or the heart failure, then we'll see clarification. We'll also notice that sometimes there's lab diagnostics that we have to be aware of. So looking at the warnings here, we'll see if there's anything here we need to be concerned about. And it says acute hepatic injury. So it's probably important to look to see if your client had liver enzymes done. And if they haven't, maybe that should be discussed with the healthcare provider, because it is one of the precautions. And we know that somebody could get a heart failure and liver damage as a result of heart failure that should be evaluated. Okay, let's take a look at other things that could occur. We could have circumstances where clients are put on more medications that lower the heart rate, and the combination of the two could aggravate bradycardia and aggravate heart failure. So we'd want to know if our client was started on a beta blocker, not that we would stop the medication, but we'd watch it carefully. And we'd also want to be mindful of what other medications we should be concerned about when they're on these therapies. And here we go into adverse effects. And probably the most important adverse effect that we want to be aware of, aside from the cardiac, is that the client could experience depression, and they can get GI side effects, especially constipation and anorexia. And the last thing we want our cardiac person to do is to strain. So when I think about, when I consider what I would put on my next page, I'd probably put here heart failure, decreased cardiac output, bradycardia, heart block, or dysrhythmia. And here I'd probably put constipation because I'd want to kind of avoid that with this client, with a cardiac client. They can also have skin reactions and anaphylaxis. So that could be something on your care plan wheel. Okay, going back to our medication template, what I want you to consider is what you've learned is some of the key things that you should be looking at in your client situation to discuss with the healthcare provider if you notice that this medication might be continued and prescribed during any one of these events that are a contraindication or precaution, or if there's focused assessment indicating that there is a new precaution emerging that requires intervention or a new adverse effect. Okay, I hope that helps you understand a little bit about how to complete your medication template using DailyMed.